Our topic is diabetes, and presenting is me, Kalia, and Avery.
So throughout this presentation, we're going to explain what diabetes is and go over the two most common types of diabetes, which are type 1 and type 2. And we're going to talk about the causes and symptoms of diabetes and also point out the body systems affected by diabetes and review the prevalence of diabetes in America and also the treatment options for patients with diabetes.
So, the first thing we'll go over is what is diabetes. And diabetes can be defined as a disease that develops when the pancreas does not make enough insulin or any insulin at all, or the body is not using the produced insulin effectively.
To further understand what diabetes is, it is important to understand the basic physiology of insulin, glucose, and glucogen. So, glucose is the body's primary source of energy, and the body breaks down food into glucose to release it into the blood. So, insulin is a hormone that helps glucose enter the cells and be used as energy. And then glucagon is a hormone that regulates the blood sugar levels and increases the blood sugar levels and also helps regulate the blood sugar. So this diagram here just shows the relationship of each hormone and how it regulates the blood sugar. There are many different types of diabetes, but the most common types are type 1 and type 2. So, type 2 is generally caused when the body's immune system destroys cells that are made in the pancreas that produce insulin. And this can be caused by genetics or exposure to infection, but essentially, the body makes little to no insulin.
Type 2 is typically a result of insulin resistance in the muscle, fat, and liver cells, causing the cells to lack blood sugar that they need for energy production. When the pancreas underproduces insulin, the body is in a constant state of unhealthy blood sugar levels. And this can be seen in people who overeat or lack exercise, or both in combination. When people are overeating, their body's not producing enough insulin to combat that constant carb glucose load. And when people don't exercise, they're having these high blood sugar spikes and nothing to combat that. So that's where you would see type 2 diabetes.
So, since there are multiple types of diabetes, there are many different risk factor, but the main risk factor is genetics. But for type 1, the main risk factors are family history, genetics, geography, and age. And then for type 2, it is weight, fat distribution in the abdomen, inactivity, family history, age, and cholesterol. Diabetes can create many different issues in the body that can be life threatening. So, there are many different comorbidities and diseases that accompany diabetes.
So next, we're going to talk about effects of diabetes, or the body systems and the body systems affected by diabetes. So the effects on the body can range from minimal to severe. And some of the effects include like neurological conditions such as cerebrovascular disease, stroke, and neuropathy. Psychological effects include possible depression or dementia, and this can be from a hormonal imbalance because insulin is a hormone. It can also just be from that long-term chronic diabetes. Metabolic disorders, including pancreatitis or obesity, are also linked with diabetes. Urinary system issues with kidney failure, renal impairment, or even neuropathy are also a common sign of diabetes. And then cardiovascular system is another thing people can have effects with when having diabetes. But like I said, it can be minimal to where you have frequent urination to other things where you're just like having to get limbs cut off because they go dead, like necrosis.
So, one main system affected by diabetes is the cardiovascular system. So, when the blood sugar is very high, it can damage the blood vessels within the body and it can lead to thinning of the artery walls or plaque building up within the arteries, which can increase the risk of coronary artery disease or heart attack, heart failure, or atherosclerosis.
The digestive system is another system affected by diabetes, and this is the main system people think of as being affected by diabetes because of eating and the insulin. This is because type 1 diabetes is in the pancreas. Typically, that's the organ that's underperforming. And then insulin is something that people use to actually treat type 1 and type 2 diabetes because their pancreas obviously is not producing enough or at all any of it. And people have to consider the foods they eat when living with diabetes just so they can avoid those blood sugar spikes or help get their blood sugar up if it's too low.
So, another system affected by diabetes is the circulatory system and the nervous system. So, diabetes can actually increase the risk of stroke or peripheral neuropathy due to the decreased blood flow to the blood vessels throughout the body. And the diseased blood vessels can further develop into nerve damage, and that can lead into ulcers or necrosis. So, in type 2 diabetes specifically, necrosis can occur on the feet or hands and can produce ulcers that could require amputation. So, this diagram on this slide really shows how the blood vessels and the diseased blood vessels could eventually lead into nerve damage.
So some of the symptoms of diabetes can vary just like the effects. Some of the common symptoms are frequent urination, sweet smelling urine, weight loss, weight gain, fatigue, excessive thirst, change in vision, and change in appetites. And those also go hand in hand with the body systems affected by diabetes. And we also included a chart that shows some of the common side effects of diabetes. This chart actually is more common with type 1 diabetes, and all diabetes can lead to fatalities if proper care is not given, and the body can begin to shut down, and this can be detrimental to someone's health. And the severity can also differ depending on the type of diabetes and the person who has it and the progression of it. Some people with type 1 diabetes, if they go long periods without treatment and they don't know what's wrong with them, can even enter things like comas. And like Avery mentioned before, people with type 2 diabetes can deal with necrosis.
So, diabetes is a very common disease. Over 29 million Americans deal with diabetes. Type 2 is more common than type 1, and 10.5% of the adult population worldwide have type 2 diabetes. And the most common individuals who contract or have diabetes are middle aged individuals, as well as men and people of color.
And some of the treatment options also differ from person to person and depending on the type of diabetic. Um, so we have insulin pumps, glucose monitors. Some physicians even suggest the ketogenic diet because it's low carb and it'll reduce those insulin spikes. So that would be good for people with type 2 diabetes as a temporary thing. Exercise can also help, especially with people with type 1 or type 2, even gestational diabetes in pregnant women. Exercise can help because it'll lower those blood sugar spikes. And then overall lifestyle changes, whether that's changing your diet, changing just the way you live so you can manage diabetes better on a life management standpoint. And then these are our references.
That's the end of our presentation. We hope you learned more about diabetes, and please let us know if you have any questions. Thank you.